5 o'clock, the state health commissioner says social distancing is pushing back projected peaks in our cases. The state health department reported 331 new cases today and 7 new deaths. We've seen higher daily jumps. One model showed the peak happening this week. But Dr. Christina Bach said today that she still expects the peak to happen near the end of April in Marion County. Other areas may not see peaks until May. Well, new data suggests that the racial breakdown of COVID-19 cases in our state a little bit different. Multicultural reporter Katira Winfrey joins us now with more on that. Katira.
Well, Phil, Marion County makes up the brunt of known coronavirus cases in line with other neighboring states. It's in line with what other neighboring states are seeing. Black people account for a large percentage of cases despite only being 10% of the state's population.
Coronavirus has touched every county in the state, and health officials say 300 people have died as a result of it. But data recently released by the Indiana State Department of Health shows a closer breakdown of which Hoosiers are catching the virus.
It's great that COVID has actually kind of highlighted the disparities.
There have been about 8,200 confirmed coronavirus cases. White people make up about 50% of the coronavirus cases in the state. Black people make up about 20%. It's an interesting breakdown as black people only make up 10% of the state's population compared to white people who make up 85% of the population.
A lot of the deaths are due to a variety of factors, not simply health related. And so the sooner we can come together and coalesce around that, the sooner we can probably help address some of the disparate outcomes.
Indiana's breakdown of actual coronavirus related deaths by race show black people make up about 20% of deaths. Brianka Merritt works for the IU Center for Research on Inclusion and Social Policy, and poverty and coronavirus may not be the common denominator in many new coronavirus cases.
But poverty itself is not an issue, because if that were the case, we would see lots of other communities feeling the similar effects of this.
Instead, it may boil down to the inability to work from home and difficulties social distancing.
And officials say while we are working to stop the spread, this could be valuable information for someone to perhaps take even more safety measures. You can find out how to access the full breakdown of the State Department of Health numbers at wishtv.com. Reporting in the studio, I'm Wish TV News 8's multicultural reporter, Katira Winfrey.
All right, Katira, thanks so much. Now to I-Team 8 and the spike in coronavirus cases in nursing homes. Our I-Team has learned of a high number of cases at a facility in Plainfield, and a lack of personal protective gear may be making it worse. Here's I-Team 8's Richard Essex.
Nursing homes in the state of Indiana are not given priority access to the state's share of the national stockpile of PPEs, which has allowed the virus to spread very quickly. Cumberland Trace Nursing Home in Plainfield has had a number of residents and staff test positive for the COVID-19 virus. The owner of the facility has not said how many residents have died from the virus or how many members of the staff have tested positive. I-Team 8 has been told by a person close to the facility that at least 11 residents have tested positive and are in quarantine. In a statement sent to Wish TV, this pandemic has caused a loss of life among the resident population. We grieve those losses with the families and associates at Cumberland Trace. Dr. Christina Bach, Commissioner of Indiana State Department of Health, said recently that long-term health care facilities accounted for 15% of the deaths reported statewide.
Our strike teams have engaged with nearly 200 facilities and have tested nearly 600 people. And this includes residents of long-term care facilities, residential facilities, group homes, and correctional facilities. Of those tested, 191 came back positive, with nearly 170 of those being among our long-term care residents.
The State Department of Health strike team has been to Cumberland Trace at least once. I-Team 8 has been told by a person familiar with the facility there is a lack of personal protection equipment for the staff there at Cumberland Trace. We did see several people on campus with masks on. Cumberland Trace has posted signs in the doors and following the state guidelines to prohibit visitors. We did see family members come to the parking lot to hold conversations through open windows. The state says the people in nursing homes are our most vulnerable population. A new rule set out by the Indiana State Department of Health requires long-term health care facilities and nursing homes to report any cases of COVID-19 that have caused death in residents or staff to be reported within 24 hours to the state. In Indianapolis, Richard Essex, Wish TV, wishtv.com, and follow us on Facebook.
All right, Richard, thank you. Meanwhile, an entire family in Westfield tests positive for the coronavirus. Now they're all in recovery, Phil.
Yeah, News 8's Leah Hodges tells us the advice they're now sharing with others.
Sean Stevens and his wife Heather came to Lilly to get tested earlier this month. Heather was tested negative, but Sean, he was tested positive. But he tells me he didn't need a test to let him know he had it, as he's been feeling symptoms since March. This is video of Sean's two young boys at their basement's window. They're visiting Sean while he's in isolation for 14 days. Sean says he reached a fever of 105 degrees and says the feeling is nothing like the flu. After isolation, Sean says he thought he recovered, but the fever and other symptoms showed up again. Sean went back into quarantine for 7 days. Now his two sons are showing symptoms of COVID-19.
I'm not really worried about Cooper at all. Cooper's very, very healthy. Brody's very, very healthy too, but he has severe asthma. And he's been in the hospital twice for it. And the thought of him having any kind of respiratory issue and having to go to the hospital for that, Heather and I wouldn't be able to be with him. That's terrifying.
The father says his doctor recommended he take over-the-counter medicine like Tylenol to treat his fever and other meds to reduce his dry cough. He plans to get retested this week so he can donate plasma so health officials can test his antibodies to treat critically ill patients. Sean says he will continue to share his story to help other people who have also been tested positive for coronavirus. Reporting in Indianapolis, I'm Leah Hodges, WISH TV, WISHTV.com, and follow us on Facebook.